All right, so it's really no secret that smoking is not good for you. In fact, it is well documented that there are detrimental effects on your mouth. So let's talk about how smoking can negatively affect your oral health. First of all, have you ever seen a smoker's teeth? They're usually very, very stained, yellowing due to the tar and nicotine in the tobacco products. So it's not a good look. And of course, that smoke is an irritant, and it definitely is going to cause inflammation of the soft tissue, the gums. And we know that advanced gum disease, periodontal disease, negatively affects the teeth. You lose your teeth early. Do you want to do that? I think not. Make sure that your patient understands all that he or she is signing up for when they decide to put that cancer stick in their mouth. You know, this smoke just, it affects the immune system. It affects blood flow to the gums, and so they lose the war. They become inflamed. And as long as that irritant is there, it's going to create a problem. And another thing that smokers may not realize is that gum that has a reduced blood flow may not look like it has a challenge at all. It may look like normal tissue when there is gum disease, because when there's not a lot of blood flowing to the area, it makes periodontal disease harder to diagnose. And of course, we know that smokers have an increased risk of losing their teeth, primarily due to gum disease. Why? Because advanced gum disease has a lot of bone loss going on there. And I don't have to tell you about the correlation between smokers and cancer, oral cancer, throat cancer, lung cancer, because of all those carcinogens present in tobacco products.